Welcome to this NMC OSCE tutoring video. My name is Hannah. I'm a UK registered nurse, a university lecturer, and I've been an NMC OSCE programme lead. And on this channel, I share my advice, teaching, demonstrations to support you in self-studying and passing your NMC OSCE exam. So in this video, I'm going to look at the assessment station for pneumonia in more depth, and I'm going to do a full verbalisation as if I was going to go through that station. So I'm going to go through those key principles, I'm going to go through the APIE assessment, I'm going to demonstrate and do the News 2 documentation and escalation, and also the holistic assessment questions. This will be a full 20-minute verbalisation demonstration of all those key components that you need to do in that assessment station. Okay, so I've just put my 20-minute timer on. Remember, this is a 20-minute station. You need to get through the core components safely and to a good high quality standard. You can't do everything in the assessment station because of the time limit. So I've just put my 20-minute timer on. Remember, you've got 20 minutes to complete the station. Time management is essential. You need to have a clear, structured pathway through this assessment station, and you need to be able to move through it with competence and confidence and make sure it's really clear to the examiner what you are doing. So you'll have your briefing from your examiner, and then you are going to start your station. So the first thing we want to do is quickly read through that paperwork and identify the key aspects of this patient's admission and kind of prioritise those key areas for us. So I'm going to use the pneumonia APIE assessment station. I'm going to start my clock. And off we go. So we've got Robin. I'm just going to read the briefing here. So brought into emergency department, shortness of breath, temperature, reduced mobility, been treated at home for community-acquired pneumonia, which is not improved, and is now being admitted to hospital, being transferred to the medical assessment unit, was receiving 45% oxygen, but is now maintaining his saturations. Okay, so just my briefing. So today is today, and the time is 10 o'clock. And I've been asked to complete my holistic assessment, my APIE assessment, and my News 2 documentation. So I'm going to have a quick look through the paperwork here and identify key parts. So obviously 2-week history of a chest infection, increasing shortness of breath and tiredness. He's been admitted via an ambulance, and he's been started on antibiotics and had a chest x-rays confirmed right lower pneumonia, and he's got reduced mobility. Finding it difficult to mobilise independently with his stick. Past medical history, so chronic obstructive airway disease, hypertension, osteoarthritis and urinary frequency. I'm going to have a quick look at the social history. So lives alone, that's something I need to pick up in my holistic just to see how he's managing. Also a smoker, so I need to pick up there on some health promotion. And his wife has recently died. So again, just key things I'd be expected to pick up on. Used to go to the social club, but has not been for 6 months. I've got my drug history here, and I know there's allergic to penicillin. Okay, so I've had a quick read of my paperwork. I know what I'm going to go into, and I'm going to start and go into my station. So I'm going to check the scene for safety. I'm going to make sure there's no hazards, that it's safe for me to approach, and I'm going to approach my patient. I'm going to maintain privacy and dignity. So I'm going to make sure I either close the curtains or shut the door. And then I'm going to decontaminate my hands using the World Health Organization 7 steps. So palm to palm, palm or back of hand, fingers interlaced, palm to palm, fingers interlocked, thumbs, fingertips, wrists, and allowed to dry. And I'm going to introduce myself to the patient and confirm my ID checks as well. So hello Robin, my name's Hannah. I'm the nurse looking after you today on the medical unit, and I understand that you've come in today with some difficulty in breathing, and we think you've got pneumonia. So what I want to do today is a full assessment of you, so physical assessment with some observations, and then I'm going to ask you some questions around your health and social care. Is that okay, and do you consent for me to do that? Okay, thank you, Robin. Before I continue, I just want to check your ID and your allergies before I go on with that assessment. Okay, so could you just tell me your full name and date of birth, please? Okay, so I've got Robin Thomas, and your date of birth, you said, is the 14th of the 2nd, 1955. So I'm checking that against my documentation, which matches. And is it okay if I can just have a look at your wristband? So I'm just checking this against my wristband here. I've got Robin Thomas, 14th of the 2nd, 1955, hospital number F1469581, which I can see matches the wristband and my documentation here. So hospital number F1469581. And Robin, I see you've got a red wristband on there. Have you got any allergies? Okay, so you're allergic to penicillin. And what kind of reaction do you get? Rash and swelling. Okay, thank you. I can see that's clearly on that red wristband as penicillin, and it's documented in your notes. And I'm not going to give you any penicillin-based products or antibiotics today. So like I said, Robin, I'm going to complete a full assessment of you. So I'm going to do some observations and I'm going to ask you some few questions. So are you happy for me to carry on with that? Okay, thank you. And before I do that, I just want to check that you're comfortable, you're feeling okay with your breathing, and haven't got any major concerns before I start. Okay, great. So you haven't got any pain and you're feeling quite comfortable in your position. Okay, perfect. So I'm just going to start with A for airway. So I am going to confirm, Robin, that you've been talking to me in full sentences, so I know that your airway is patent and clear and there's no signs of the visual obstruction. Just going to go and get the rest of my observation equipment here. So I'm just going to do a hand hygiene here because I had touched the patient. And I'm going to go and get my observation machine. So I'm going to move on to breathing, and I want to record the respiratory rate for 1 full minute. Robin, I'm just going to be quiet for a minute actually, and I just want you just not to talk to me, and it's just part of my assessment. So I'm just going to be quiet for 1 minute, and if you don't talk, that would be great. So my 4 minute starts now. I'm going to use my fob watch, okay? And in your exam, you want to wait that full 1 minute, that's 60 seconds, and then you're going to verbalise your results, okay? So let's assume our minute has passed, and I'm going to confirm that, Robin, so whilst I was doing that and being quiet, I was monitoring your respiratory rate, and your respiratory rate was actually increased, so it was 24 breaths per minute. So that is slightly elevated, so we're looking for a respiratory rate between 12 and 20. I noticed though that the rhythm was regular, the depth was a little bit shallow, and I know you have come in with some difficulty in breathing. However, I couldn't hear any respiratory noises such as wheezing or stride or rattle, but I did notice that you were coughing and you have got a productive cough. I also, though, couldn't see any signs of respiratory distress, so there was no seesaw breathing, there was no use of your accessory muscles, you're not cynosed, and I can't see any sweating. I could also observe that you had equal air entry in both sides of your chest rising. So the respiratory rate is a little bit high, so that will be something that I will be escalating. And I'll just make sure that you're in a good upright position, which is going to help you. I'm going to move on and just check your oxygen saturation. So I'm going to take my oxygen saturation probe, and I just need to pop this on a finger, Robin. Have you got a preference? No, okay, so I'm going to use this finger, and I'm just going to confirm that that finger's got no nail varnish and it's clean, and not got any fake nails or anything like that on. And I'm going to pop my probe on here and just allow for that to read. Okay, and that says your oxygen saturations are 96%. So even though you find it a little bit difficult to breathe, your oxygen levels are within normal, which is good. So I'm going to move on now to my circulation, and I need to record your radial pulse on your arm for full 60 seconds. So are you happy for me just to place my fingers here? Okay, that's great. Again, in your exam, you're going to wait that full 60 seconds and then you'll verbalise your results. So I'm going to move on here just so you're not just watching a blank screen for full 60 seconds. But so let's assume our 60 seconds has passed, and I am going to verbalise that. So Robin, I've measured your heart rate here on your radial pulse, and your heart rate was 60, which is normal, and the rhythm was regular and the strength was strong. And whilst I was touching your hand there, I could tell that you were quite warm. There was no signs of pallor, and you looked well perfused. I'm going to check your blood pressure now, so I need to put the cuff onto an arm. I don't know if you've got a preference. Okay, so this right arm. And have you had any surgery? There's no cannulas there, no fistulas that I can see. Okay, so I'm going to place that blood pressure cuff then 2 to 3 centimetres above your brachial artery. I'm just going to palpate that here. And I'm going to make sure that cuff fits, and I need to make sure your arm's at heart level, so I just want to prop that up against a pillow. Okay, and just check that you haven't had a cigarette or any caffeine in the last 30 minutes. And ideally that you've just got your legs uncrossed and you're rested. That's perfect. So I'm happy with the fit of this cuff, and I'm going to place and turn that blood pressure cuff on. And whilst that's going on, I'm going to check your capillary refill on your other hand. And this involves me just squeezing onto your finger for 5 seconds. And I'm just going to look for the return of perfusion. So you're happy for me to do that? Okay, so I'm just going to press down now. 1, 2, 3, 4, 5. And that comes back 1, 2, less than 2 seconds. So I'm happy that your perfusion is good. And again, you're nice, warm and perfused and no pallor. And now your blood pressure has come back and it's 110 over 60. So is that a normal blood pressure for you, Robin? Because I know from your history that it says you've got high blood pressure. A little bit low. Okay, so I'll just be escalating that as well. It might just be due to the infection as well, which could lower your blood pressure a little bit with that. So I've finished with circulation. I'm going to go on to disability. So I'm going to assess your conscious level. So I can see that you are being alert and talking to me, which is great. But I just want to make sure that you've not got any confusion. So Robin, can you just tell me where you are again? Okay, yep, that's right. You're in the hospital in the medical ward. And do you know the date today? Yes, that's correct. That's right. And just tell me again your name and date of birth. Perfect, that's brilliant. So you are, I can confirm that you're alert and you're not confused. So Robin, I know I asked you at the beginning if you had any pain, but I just want to check in again. Have you got any pain at all, on a scale of 0 being no pain and 10 being the worst pain that you've ever experienced? Where would you rate your current pain level? So it's 0, so that's great. So I'm glad you're comfortable. And have you been to the toilet and passed urine today so far? You have, and is that kind of been normal for you? It has. Okay, that's great. And do you know if anyone's come and taken your blood sugar and pricked your finger? They have. Okay, so examiner, can you just confirm the most recent blood sugar for me? Okay, so that is 6, so that's within normal limits. So I'm happy with that, and I'm going to move on to exposure. So I'm going to take your temperature, Robin, with this thermometer, which I need to place just in front of your forehead, and I'm just going to take that now. That's 37.5, so that is within the normal range. And I just want to ask, have you got any rashes, bruises, injuries, bleeding, anything top to toe that I need to be aware of? No, okay, that's great. And my last question is your medical history. So I'm just going to go back and have a look at your notes. And I can see from your medical history that you've got chronic obstructive airway disease, you've got hypertension, osteoarthritis, and urinary frequency, and obviously this recent community-acquired chest infection. So have you got any other past medical history that I need to be aware of at all? No, okay, that's great. So Robin, I've finished your A2 assessment now. I'm going to go and do my documentation of these observations, and then I'm going to come back and ask you some more questions around your health and social care. Is that okay? You need anything before I do that? No, okay, so that's great, thank you. So I'm going to decontaminate my hands using the World Health Organization 7 steps. So I'm going to go and do my News 2 documentation now, just at the end of the bed. Okay, I'm going to do my documentation here. So I'm going to put the date in, so that will be my test centre date, which I'll put in as today. And the time, which was on my station briefing, which was 0800. That bit smaller to fill in the box. And now I'm going to do my documentation. So my respiratory rate was 24. I'm just going to put my dot in here. So that scores a 2. Saturations are normal, 96%. On scale 1. And the patient was on air. So I'm going to write an A in the box here. My blood pressure was 110 over 60. So that is just going to score here in that one box. So 110 is this line here, so it's just under this line here over 60. So 60 is here, just under this 61 line here. I do my dash line. Should be easier than doing it on a computer. My heart rate was 60, which I'm going to document just under the 61 line here. So that doesn't score. My patient was alert, so again I'm going to put a dot in the alert box here. My temperature is 37.5 in the middle of this box here. So my total news score is going to be 2 for my respiratory rate, and 1 for my blood pressure. So this is making a total NMC score of 3. My monitoring frequency, so I've got 3, but it's made up of a 2 and a 1, so that's here. So my monitoring frequency is 4 to 6 hourly. So I'm going to put in 4 to 6 hourly. I am actually going to escalate this because of the respiratory rate and the blood pressure being a bit lower than normal. And I'm going to put my initials in here. Okay, so I've finished my documentation. I'm happy that that's correct. So I'm going to go back to Robin. I'm going to decontaminate my hands using the World Health Organization 7 steps. I'm going to explain my NMC 2 results to the patient. So Robin, I've come back now and I've completed your NMC 2 and you've scored a 3. So this is because your respiratory rate is scored a 2 because it's elevated and your blood pressure is a little bit low, which is a 1. So I'm going to monitor you 4 to 6 hourly as per the policy. I am going to escalate with this and just discuss it with the doctor because you are finding it a bit difficult to breathe and your blood pressure is a bit lower than normal. Okay, so now I just want to go on and ask you a few more questions as part of that holistic assessment. So I can see that you've had this pneumonia for a couple of weeks and you've had 2 lots of antibiotics. When has it just started? When did your breathing start to get significantly worse? Okay, so the last 48 hours. And have you taken all your antibiotics that you've been prescribed? You had. Okay. So like I said, we think we've got a pneumonia there. So we'll get the doctors to review it. We most probably will give you another course of antibiotics and support you hopefully and until that improves. I can also see here that you've got reduced mobility. You find it difficult to mobilize with the stick. So can you tell me a little bit more about that, Robin? What have you been finding difficult with the stick? Okay, so yeah, just not feeling as stable and finding it a bit harder with your osteoarthritis. Yeah, I totally understand that. So I could refer you to our physiotherapist if you consent to that, and they could do an assessment and see if there's any different mobility aids and maybe some exercises and things that we can do to help you with that. Okay, that's great. So I've done my physicals. I'm just going to go on to psychosocial. So Robin, I see that you live alone, and I see that your wife died fairly recently due to cancer. I'm so sorry for that. That must be a really difficult time for you after being married. I just want to see how you're coping by yourself and whether you feel you'd want any additional support in the home and whether we can offer you any support following your bereavement as well. Okay, so you're finding it a little bit difficult to manage at home. I see your daughter lives nearby and visits twice a week, but do you feel you need some additional support in the house with activities of daily living? Okay, so I can make an initial contact with social services and just see, in preparation for discharge, if there's anything that we can do. I could also do a referral to occupational therapy. Potentially they could do a home assessment, just see if there's any aids and support that they could put in the home as well. Okay, would you be happy with that? Okay, that's great. I also see from your notes that you're a smoker. I know it's difficult to give up, and especially been smoking a long time. But we know that that contributes to your chronic obstructive airway disease, but also your current pneumonias. Is it something that you've considered giving up, and would you like some additional support, maybe to try again? Yeah, I understand. Yeah, I understand it is difficult, but there are lots of different kind of new therapies available now as well. I can bring you some more information about that. You could just read that in your own time and then make a decision later. Okay, I'll do that for you. And then if you've got any questions, you can ask me, and we can refer you to these sensation services as well. And I just want to ask if you've got any spiritual or cultural needs whilst you're in hospital. Okay, none at all. That's great. And I see you've got your daughter who lives nearby. Have you got anyone else who's significant or any other next of kin that we should be aware of? No. Okay. So does your daughter know that you're in hospital? She doesn't. Would you like me to contact her with your consent and just explain that you've been admitted to hospital? Okay, I will do that. That's great. So I think I've finished my assessment here, Robin. I am going to escalate your respiratory rate and blood pressure to the doctors, going to get them to review your medications and antibiotics. I am going to make those referrals to physio and social services, and I'll bring you some smoking cessation advice as well. So if you've got any further questions before I go. Okay, thank you. So I'm just going to finish the station by decontaminating my hands with my final hand hygiene. And I finished my station. I've got 2 minutes on the clock, but obviously I needed 2 minutes to complete that respiratory rate and the pulse rate as well. So just within that 20 minutes there for that station. I'm going to stop my clock. So I hope that was helpful for you to see how you can piece together that whole assessment station. The verbalisation is the key in the OSCE, and that's what you really need to practice to be able to get it within the time. Depending on how well your time management is will depend how much you get to cover in that holistic assessment, but you really want to be getting through that A2 assessment relatively slickly and quickly, so you've got room for your holistic assessment, plus so you've got room to answer any potential questions from a patient actor as well. When you're practicing just by yourself or doing it just like I did, you don't have that communication with the patient actor. So we want to be making sure we've got a buffer of time to do that as well. But I hope that's helpful for you, just to see that whole station put together. And if these are videos that you find useful, I shall look to do some more of those as well.